It's just gone 7 p.m. in the United Kingdom, where Prime Minister Boris Johnson is about to address the nation. He's expected to lay out stages for lifting the country's coronavirus lockdown. Let's listen in.
And you have shown the good sense to support those rules overwhelmingly. You've put up with all the hardships of that programme of social distancing because you understand that as things stand, and as the experience of every other country has shown, it's the only way to defeat the coronavirus, the most vicious threat this country has faced in my lifetime. Experience of every other country has shown it's the only way to defeat the coronavirus, the most vicious threat this country has faced in my lifetime. And though the death toll has been tragic and the suffering immense, and though we grieve for all those we have lost, it is a fact that by adopting those measures, we prevented this country from being engulfed by what could have been a catastrophe in which the reasonable worst-case scenario was 500,000 fatalities. And it's thanks to your effort and sacrifice in stopping the spread of this disease that the death rate is coming down and hospital admissions are coming down. And thanks to you, we've protected our NHS and saved many thousands of lives. And so I know, you know, that it would be madness now to throw away that achievement by allowing a second spike. We must stay alert. We must continue to control the virus and save lives. And yet we must also recognise that this campaign against the virus has come at colossal cost to our way of life. We can see it all around us in the shuttered shops and abandoned businesses and darkened pubs and restaurants. And there are millions of people who are both fearful of this terrible disease and at the same time also fearful of what this long period of enforced inactivity will do to their livelihoods and their mental and physical well-being, to their futures and the futures of their children. So I want to provide tonight for you the shape of a plan to address both fears, both to beat the virus and provide the first sketch of a roadmap for reopening society, a sense of the way ahead, and when and how and on what basis we will take the decisions to proceed. I'll be setting out more details in Parliament tomorrow and taking questions from the public in the evening. I've consulted across the political spectrum, across all 4 nations of the UK. And though different parts of the country are experiencing the pandemic at different rates, and though it's right to be flexible in our response, I believe that as Prime Minister of the United Kingdom, Scotland, England, Wales, Northern Ireland, there is a strong resolve to defeat this together. And today, a general consensus on what we could do. And I stress could, because although we have a plan, it is a conditional plan. And since our priority is to protect the public and save lives, we cannot move forward unless we satisfy the 5 tests. We must protect our NHS. We must see sustained falls in the death rate. We must see sustained and considerable falls in the rate of infection. We must sort out our challenges in getting enough PPE to the people who need it. And yes, it's a global problem, but we must fix it. And last, we must make sure that any measures we take do not force the reproduction rate of the disease, the R, back up over 1, so that we have the kind of exponential growth we were facing a few weeks ago. And to chart our progress and to avoid going back to square one, we're establishing a new COVID alert system run by a new joint biosecurity centre. And that COVID alert level will be determined primarily by R and the number of coronavirus cases, and in turn, that COVID alert level will tell us how tough we have to be in our social distancing measures. The lower the level, the fewer the measures, the higher the level, the tougher and stricter we will have to be. there will be 5 alert levels. Level 1 means the disease is no longer present in the UK, and level 5 is the most critical, the kind of situation we could have had if the NHS had been overwhelmed. Over the period of the lockdown, we've been in level 4, and it's thanks to your sacrifice we're now in a position to begin to move in steps to level 3. And as we go, everyone will have a role to play in keeping the R down by staying alert and following the rules. And to keep pushing the number of infections down, there are 2 more things we must do. We must reverse rapidly the awful epidemics in care homes and in the NHS. And though the numbers are coming down sharply now, there is plainly much more to be done. And if we're to control this virus, then we must have a world-beating system for testing potential victims and for tracing their contacts, so that, all told, we're testing literally hundreds of thousands of people every day. We've made fast progress on testing, but there is so much more to do now, and we can. When this began, we hadn't seen this disease before, and we didn't fully understand its effects. With every day, we're getting more and more data. We're shining the light of science on this invisible killer, and we will pick it up where it strikes, because our new system will be able in time to detect local flare-ups in your area, as well as giving us a national picture. And yet, when I look at where we are tonight, we have the R below 1, between 0.5 and 0.9, but potentially only just below 1. And though we have made progress in satisfying at least some of the conditions I have given, we have by no means fulfilled all of them. And so, no, this is not the time simply to end the lockdown this week. Instead, we're taking the first careful steps to modify our measures. And the first step is a change of emphasis that we hope that people will act on this week. We said that you should work from home if you can, and only go to work if you must. We now need to stress that anyone who can't work from home, for instance, those in construction or manufacturing, should be actively encouraged to go to work, and we want it to be safe for you to get to work. So you should avoid public transport if at all possible, because we must and will maintain social distancing, and capacity will therefore be limited. So, work from home if you can, but you should go to work if you can't work from home. And to ensure you are safe at work, we've been working to establish new guidance for employers to make workplaces COVID secure. And when you do go to work, if possible, do so by car, or even better, by walking or bicycle. But just as with workplaces, public transport operators will also be following COVID secure standards. And from this Wednesday, we want to encourage people to take more and even unlimited amounts of outdoor exercise. You can sit in the sun in your local park, you can drive to other destinations, you can even play sports, only with members of your own household. You must obey the rules on social distancing, and to enforce those rules, we will increase the fines for the small minority who break them. And so, every day, with ever-increasing data, we will be monitoring the R and the number of new infections and the progress we are making. And if we as a nation begin to fulfill the conditions I have set out, then in the next few weeks and months, we may be able to go further. In step 2, at the earliest by June the 1st, after half-term, we believe we may be in a position to begin the phased reopening of shops and to get primary pupils back into schools, in stages beginning with reception, year 1 and year 6. Our ambition is that secondary pupils facing exams next year will get at least some time with their teachers before the holidays, and will shortly be setting out detailed guidance on how to make it work in schools and shops and on transport. And step 3, at the earliest by July and subject to all these conditions and further scientific advice, if and only if the numbers support it, we will hope to reopen at least some of the hospitality industry and other public places, provided they're safe and enforce social distancing. Throughout this period of the next 2 months, we will be driven not by mere hope or economic necessity. We're going to be driven by the science, the data, and public health. And I must stress again that all of this is conditional. It all depends on a series of big ifs. It depends on all of us, the entire country, to follow the advice, to observe social distancing, and to keep that R down. And to prevent reinfection from abroad, I'm serving notice that it will soon be the time, with transmission significantly lower, to impose quarantine on people coming into this country by air. And it's because of your efforts to get the R down and the number of infections down here that this measure will now be effective. And of course, we will be monitoring our progress locally, regionally, and nationally. And if there are outbreaks, if there are problems, we will not hesitate to put on the brakes. We've been through the initial peak, but it's coming down the mountain that is often more dangerous. We have a route and we have a plan. And everyone in government has the all-consuming pressure and challenge to save lives, restore livelihoods, and gradually restore the freedoms that we need. But in the end, this is a plan that everyone must make work. And when I look at what you've done already, the patience and common sense you've shown, the fortitude of the elderly, whose isolation we all want to end as fast as we can, the incredible bravery and hard work of our NHS staff, our care workers, the devotion and self-sacrifice of all those in every walk of life who are helping us to beat this disease: police, bus drivers, train drivers, pharmacists, supermarket workers, road hauliers, bin collectors, cleaners, security guards, postal workers, our teachers, and 1,000 more. The scientists who are working round the clock to find a vaccine. When I think of the millions of everyday acts of kindness and thoughtfulness that are being performed across this country and that have helped to get us through this first phase, I know that we can use this plan to get us through the next. And if we can't do it by those dates, and if the alert level won't allow it, we will simply wait and go on until we've got it right. We will come back from this devilish illness. We will come back to health and robust health. And though the UK will be changed by this experience, I believe we can be stronger and better than ever before, more resilient, more innovative, more economically dynamic, but also more generous and more sharing. But for now, we must stay alert, control the virus, and save lives. Thank you very much.
You're watching Al Jazeera. That was the UK Prime Minister Boris Johnson giving an update on the situation with regards to lockdown and other conditions in connection with the COVID-19 spread in the United Kingdom, setting out a conditional plan for what he called the next phase of the fight against COVID-19. But for anybody looking for an immediate end to the lockdown, no good news there. He said there would be no immediate end to the lockdown. He said it would be madness to throw away any achievement by allowing a second spike. I want to bring in Paul Brennan, who's been monitoring this for us in London. Paul, overall, the tone of the message seemed to be somewhat cautious to me. What did you take away from it?
Oh, I mean, this was a keenly anticipated television address from the UK Prime Minister. You know, we'd known 3 days ago that he was going to make it, and as a result of that delay between announcement and the actual address itself, there's been feverish speculation as to what it might contain, including, for example, that mention from Saturday of a 14-day quarantine on airline passengers arriving in the UK. In fact, during the speech itself, it really only got a very cursory mention, and with no specifics as far as time, you know, the 14 days, that wasn't mentioned at all. It was also evident in the days leading up to today that there would be a dampening down of expectation as far as details go. And I think that's what we saw from the Prime Minister's address there. Very, very heavily conditional on a whole range of different aspects, primarily, though, that critical R number, that is the infectious rate. And if you can keep it below 1, it means that the number of infections is going to keep declining. If it goes above 1, it means that the infections are rising and rising exponentially, and the risk of a second spike becomes very real. So you look at what he said, I mean, the most vicious threat this country has faced in my lifetime. We must continue to control the virus. He did nod that the campaign against the virus has come at a colossal cost to our way of life. And he said, for example, it will need testing, literally hundreds of thousands of people a day in order to get on top of this. Now, that in itself raises questions because the government set itself a target of testing 100,000 people a day by the end of April. It only got to that target, many people believe, by essentially cooking the books, counting tests which had been put in the post, not necessarily actually conducted. And since that date, they haven't got anywhere near 100,000 tests a day. So to hear the Prime Minister talk about needing literally hundreds of thousands a day, it makes you wonder how realistic we are or how close we are to achieving that kind of level of testing. That said, though, it will be music to the ears of some people in the sense of it's a glimmer of hope, but as he said, it is a first sketch of a roadmap and not a clear step-by-step definition. A lot of it is very, very conditional.
Paul Brennan, live for us in London. Paul, thanks very much indeed. I want to bring in Kevin Craig. He's the Chief Executive Officer of PLMR. It's a leading political communications agency in the United Kingdom. He's joining us on Skype from London. We appreciate your time, so thank you very much indeed. One of the recurring criticisms that this government has faced is that the messaging has been mixed, and there's more criticism because it's changed its latest message on COVID-19 from stay at home to stay secure, stay alert. Why do you think they have decided to change that message at this time?
Well, there has been enormous pressure on the government to try and indicate when the British economy is going to encounter better times. At the same time, there is equal pressure back from a Prime Minister who only a few weeks ago nearly lost his life. And we now have a very challenging problem, I think, for the government in that the messages from the government in England on health are very different and are less strong, are weaker than the messages coming out of the governments in Northern Ireland, Scotland and Wales. And one of the reasons why the retransmission rate has reduced so successfully over the past weeks is there was a slogan that instructed us, stay at home, protect the NHS and you will save lives. And I think now that this message today from the Prime Minister, I mean, everybody wants the government to succeed at this, but the challenge is it's less clear now what exactly the message is.
What do you think that they're trying to achieve, the government is trying to achieve by changing the message at this point, but using this particular wording? Well,
they're trying to help the economy start to recover. I mean, we had news from the Bank of England here in recent days of the historic challenges facing our economy, a 300-year situation in terms of the severity of the recession. And the government is trying to move us forward. But the problem today is that the governments in Scotland, Wales and Northern Ireland, they don't share this changing of message. They would have had the message stay the same, stay at home, protect our National Health Service, save lives. And the new message, stay alert, I mean, I'm a communications person. It doesn't really mean anything. There's no instruction in the same way as the last message. And I think you saw in the Prime Minister's speech just now how the government has had to come back from some of the things they were thinking of doing earlier in the week because they're just unsure about how to get this right. And we've already seen today in the United Kingdom, there is going to be a lot of uncertainty and there's a lack of clarity about what it is the government want people to do. They should really have just found different wording to try and navigate these next 2 or 3 weeks.
I want to ask you about this new alert sequence that the Prime Minister was talking about as well, where one essentially at the bottom is that there's no COVID in the UK, and 5 is that the NHS is close to or is overloaded. And it was this mathematical, very simple mathematical system of R plus the number of cases. In terms of, again, the clarity of message, across the UK, given, as you say, Scotland, Wales and Northern Ireland are doing their own thing, is this actually going to mean anything to anybody?
Well, to be actually fair to the Prime Minister, I think this regional approach is very clever. I can assure you, seeing the streets of London in the last 48 hours, it is a very, very varied picture. In some places across the capital city yesterday, you would have been hard-pressed to think there was a crisis on at all. People had been led to believe by the media coverage that the situation was much better than the Prime Minister's speech has conveyed just now. So I think it's very sensible, given the immense differences in infection and COVID rates across the country, that there is this system. It makes sense because at the moment, quite frankly, if you live in the east of England, you are at a statistically much lower risk than you have been in London or that you are currently in the Midlands and up north. So that is a wise development and mirrors what else has happened across the world.
We really appreciate you giving us the benefit of your experience. Kevin Craig, thank you very much indeed.
Pleasure.